Good afternoon, everyone, and welcome to Grand Rounds. My name's Tom Fodden. I'm the chair and organizer of Grand Rounds. And if you get the email that I send out every week, you'll know that this week there was going to be a gap in the program. So I scrabble around trying to think what to talk about, an interesting topic in respiratory medicine you might enjoy. But I've been rescued, or perhaps you've been rescued from that, by a late entry of an external speaker who's going to come talk today, and that's Malik Zaben, who is Associate Professor of Neurosurgery at the Arab American University in Palestine. And I'm grateful to David Russell, who's in the audience today, for linking us together. Malik is going to talk about, well, the title on the screen, the challenges and opportunities of providing medical education in the conflict zone. I think this is going to be absolutely fascinating stuff. We have challenges here. It's if you're involved in medical education, I suspect much of the audience is, the challenges of trying to provide high quality medical education to undergraduate and postgraduates here is challenging enough, but to do that in essentially a conflict zone, I think this is going to be fascinating to hear. Malik tells me he's in Cardiff at the moment, and then he's coming to Dundee next week. So I'm really looking forward to meeting you in person, Malik, and just again extend the thanks for stepping in at such short notice. If you have any questions, please put them in the chat. I will have the opportunity to speak at the end. I'm sure there'll be plenty of questions, and just make sure you're muted. Apart from you, Malik, welcome to Grand Rounds.
Brilliant. Thank you. Thanks, Tom. Thanks for giving me this opportunity to address your audience. Thanks, everyone, for your interest. Thanks also to David, who's linked both of us and contributed to this opportunity. Look, I'm addressing you today from Cardiff, like Tom has said, as I am on a visit to celebrate Eid as we conclude Ramadan. Hopefully tomorrow. So I'm on a short visit. But otherwise, it might be really useful to give you a little bit of background on this while we are on this screen, on this slide, on my background. So I trained up as a neurosurgeon here in the United Kingdom. So I came back in 2004, did a PhD in Southampton, then joined, I ran through training in neurosurgery before I qualified as a consultant in neurosurgeon with a fellowship to the Royal College of Neurosurgery. Today I'm addressing you wearing two hats, actually. One of them as a dean of the Faculty of Medicine in the Arab American University. It is a new medical school in the area of Jenin, which probably those who follow the news would hear Jenin repeatedly on the news. It's an area in the West Bank where most unrest is at the moment. I'm also addressing you as a CEO of a British-based charity called International Medical Education Trust, IMED 2000. And this is a charity which is active in conflict zones, particularly in Palestine, as you're going to see from the work. So today I'm going to share you my thoughts on the challenges and opportunities we've faced as we've been trying to help providing medical education, both undergraduate and postgraduate, in Palestine in the last 15 years, and certainly since I became the CEO of IMED 2000. The purpose of this talk is not only to brief to you about how bad the situation is, but it's more about looking at those challenges and see how we can turn those challenges into opportunities for mutual interest and for collaboration where we can work together. And here I say we, I'm a British Palestinian, so I could probably easily say we, and I mean it, between British people, certainly for this talk, Scottish people and Palestinian people. There are lots of common grounds on which we can collaborate and work together for the mutual benefit of both nations. So to just set the scene, really, as many of you would recognize, when you talk about medical training in a conflict zone, like in Palestine, then you immediately remember a number of things. And among these would be the political uncertainty, the civil unrest, which comes hand in glove with the political uncertainty, alongside the struggling economy, which then would lead into very debilitated infrastructures, which will have its own toll on health services and certainly on medical education. And when it comes to challenges in Palestine, and these are not my numbers, these are the numbers of the World Bank. As you can imagine, I mean, poverty and the struggle is massive, particularly in the Gaza Strip, where almost half of the population kind of live and are unemployed simply. And you can imagine, when you want to set up medical education of efforts, or when you want to set up a service, these things will have to be in the back of your mind and will inevitably affect whatever you try to do. And this is something probably worth us remembering as we talk. And no surprise, and again, this is like a global statistics, areas which would fall into the category of conflict zones would have higher mortality rates for the obvious reasons that each and every one of us can imagine. And actually, if you look into the stat, after conflict, it is higher. And the reason I mention this is that the conflict in Palestine goes through kind of phases. Like there's an uprise and it calms down, and there's an uprise and then it calms down a bit, and so on and so forth. And as you can imagine, if you look at the mortality rates during those phases, I mean, they bounce up and down, and they follow the trend, which is yeah, it's sad, but something to keep in the back of our minds. And obviously, I'm not here a politician. I'm addressing you as an academic and as a clinician, like most of you are. And therefore, the focus of the talk is going to be on what we can do, what we can do to help. And before I tell you what we try to do, it is worth looking at the literature and see whether, does continuing medical education really make a difference in a conflict zone like Palestine? And the answer to that, as many of you would agree, is yes. It's a big yes, and it is supported by strong evidence. So on those bases, when I started back in 2005, as I was concluding my PhD, and it turned out that I am not here only for the 3 years to do a PhD, because I had already decided that the opportunity actually came that I would train up as a neurosurgeon. So I started looking at a longer stay in the United Kingdom, and I was in Southampton then. So I started thinking myself here, again, as part of a good citizenship, and with kind of a mixed citizenship again as a British and as a what can we do? I mean, yeah, it is a conflict zone. We see it on the news every day. We watch it. We feel bad about it. But is there anything we can do about it? And I started really very simple there and then, because I mean, I had very limited connections and I was limited at what I could do. But the start was that I started inviting students to come from Palestine to do their elective courses here in the United Kingdom, and certainly in Southampton. And also, so that it's not one-way traffic. It was more of an exchange where I managed to send some students to go and do their electives in Jerusalem and other towns and villages in Palestine. Alongside that, also, we started thinking about organizing visits, working visits for doctors and nurses to come here, see how we go about things, and then go back and transfer knowledge. And that at that time was something really very satisfying, and I was happy with that. But it wasn't too long before we have realized that we need something much more substantial. And this is as I came and put heads together with Professor Colin Green, a professor of surgical sciences at UCL. And he had already thought of establishing a British charity which would work on providing continuing medical education in areas of conflict. And certainly Palestine was on the agenda and was kind of just started thinking of it. Then I came, joined him, and we co-founded together a branch for the charity in Palestine, which we now refer to as IMIT 2000 PAL. And we went together fundraising and we established this. And the idea was there and then that we will establish a continuing medical education center in Palestine, which will help continuing lifelong training of doctors and nurses in response to their needs. And the way we went about it, we started by conducting a survey, a need study, where we had to ask people, what do you want? What do you need the most? And no surprise, a number of items came up. And considering it is a conflict zone, trauma and emergency training was on top of the list, followed by mental health. And as many of you can imagine, physical trauma and mental trauma, they go again together, because when people suffer, struggle, that will have a toll on our brains, and it is an area of interest to me where my research is focused in neurosciences on the trauma and post-traumatic stress and all that stuff. And alongside that, interestingly, came also big interest in clinical governance and research, which back then did not exist in Palestine. No effort whatsoever was made on that. And then we, as a group of British academics and clinicians, we thought, well, if all of this to become substantial and more sustainable, then we would have to start training the trainers, where we create an environment of sustainability, and then they become over time independent from us here in the UK. So if I was to take those one by one and just tell you a little bit more about what we have done here, for example, for trauma and life-saving, we responded to the need all the way from ambulance drivers and those paramedics in the field, all the way to intensive care units and how to deal with the trauma. One of the things which we feel really very proud of is the introduction of ATLS to Palestine. You'd be amazed to know that most of the Arab countries in the Middle East had ATLS established, whilst in Palestine, we are the country of trauma. We did not have ATLS training. We had some very informal training, fractioned here and there, but nothing formal. So IMIT 2000 as a charity, as a British charity, we stepped in. We got a number of doctors. We sent them to Jordan, where they trained in ATLS. Then those who were instructor potential, we picked them up to become instructors. Again, we sponsored them to train, and then they returned home. And now we can talk about ATLS as well-established scheme in Palestine. And every 3 months, there's a cohort of doctors who come through, get trained in-house through that. And not only that, now we are expanding it to teams where we are providing trauma training for health allied and for medical students. And also we introduced some other courses which are all accredited and acknowledged by the American College of Surgeons, like Stop the Bleed. And now we've started training those in schools and public services on the immediate response, how to apply a tourniquet, how to simple measures to stop the bleed in catastrophic injuries. The approach has been rather a holistic approach, as you can see here, where we paid attention not only to doctors, but also to surgeons, to nurses, and to future doctors being medical students. And this is kind of how we've approached it. It was not straightforward. We had challenges, but it's working. And now I can talk about not hundreds, probably thousands of healthcare professionals who've gone through our schemes, including BLS and ACLS training. So as you can imagine, this was rather a very interesting program. Then we turned into child mental health, and in this one, we took a different approach. we kind of wanted to do in-house training and also to use overseas training and fellowships so that we could like support this field alongside supporting families who suffer as we speak, because some of these families, they have children who like suffer the post-traumatic syndromes and who live in it, families who are struggling. They need to attend for sessions of treatment, which they can't afford. They can't even, in some examples in Gaza Strip, they can't afford the travel expenses to attend those sessions. So we as a charity stepped in, helped those families, took with their hands and tried to provide them with the latest protocols, really in collaboration with the Royal College of Psychiatry and many other psychiatrists in this country, in the UK, particularly in Dundee. I must say, Professor Leslie Scarth stepped in and helped us big time on the front of child mental health in particular, but also, yeah, we sent groups of people who went there and trained the psychiatrists in-house, and then those who became interested and wanted to kind of develop their skills, we've managed to find them funding and brought them across here to the UK, where they trained up and completed fellowship in specialized fields of mental health. And we are very proud again of this program. Yes, we had lots of struggle. It took us a while to set it up. Certainly funding and finding the money has always been the problem, but now we can talk about a very well structured and established program, which is up and running. The other thing we looked at, and again, based on the need study, was we wanted to help people pay attention to clinical governance. I mean, I can give a lecture about the importance of clinical governance, particularly in conflict zones. And certainly you all would agree about the very initial audits started in the United Kingdom. They were all related to war, and as many of us know how clinical audit developed. So this is something we wanted to kind of do. And what I wanted to mention here, that actually Palestine is a unique lab when it comes to clinical research. It's amazing experiences, working under limited resources with all the challenges we have in Palestine. It can be an amazing, really environment for clinical research, which then can be extrapolated to other conflict zones, areas. So this is where we wanted to really foster this culture of clinical research and clinical audit as part of clinical governance. And we did this through encouraging electives to the UK, where students and doctors came here, joined different departments, tried to develop experience, and they saw how we do it. They've been to our regular audit meetings. Certainly when I moved to Cardiff, this was like a regular event where people joined us. And then we as a charity, those who've become interested, got trained, completed their set of training, we supported them through a small grant funding to start them up on very small, very low scale, really projects. But for Palestine, it was like something much needed. And alongside also a mentorship scheme, to which I'd like to invite the audience, really, if anybody is interested. This scheme is still developing under the umbrella of the Ministry of Higher Education, where now we have established what we refer to as Palestine Health Research Club, which includes now about 400 members of those young individuals who are keen to join and actually do clinical research. And it'd be lovely, really, to twin that with colleagues from the United Kingdom who feel at a position that they can mentor these young individuals as they develop their research ideas, or as they design and conduct their clinical audits or re-audit their practice. And this is something we would welcome, really, your involvement, should you feel like it. The other bit, which is probably, I think, probably the most important bit, which we had to pay attention to, actually train the trainers. So it's all good that we bring people here to train and we send groups to train them. But if we were like to make something more sustainable, as many of you would agree with me, we needed to start training local trainers in different aspects. We started with medical schools, picking up like academics from there. We started by teaching the teachers programs, because these are the guys who teach in medical schools. Also, we looked at medical students as future educators, and we started doing some training for them as potential educators. And again, coming back to Dundee, we collaborated with Ronald Harden and his team in AMI. I am a regular attender of AMI meetings, and AMI 2000 is got an institutional membership with AMI, and we've got them on board, and we got their support for healthcare professionals in Palestine, and it has been a happy relation with really substantial outputs. So if I was to share with you really gleaning over this experience, what lessons we have learned, building these relations between UK and Palestine academic institutions, I think we've got to agree that building these relations takes time. It does take time, and a lot of effort. And therefore, if I was to, I don't want to kind of become like an advisor on this, but what I've learned, we have to be patient. We will fail at some points, but if we persist and we have the vision, then it can be successful. And the key to success, I thought, is mutual respect. The last thing people in the developing world, certainly in a conflict zone like Palestine, they want is us here in the UK to go and tell them what they need, or try and impose on them what they should learn. Probably you've noticed the way we've done it in IMIT, and it has proven successful. We've asked people, what do you want? And we only respond to their needs. I used to go, before I retained on the 1st of September to take up my position as a dean in the Faculty of Medicine there, I used to go regularly and ask the Minister of Health, ask the Minister of Higher Education, ask the people, what do you want? And we will only respond to what they need. Sometimes we can, sometimes we can't. And I usually say, look, I'll go back to the UK, we will look and fundraise, and if we can find the money and we are able to support, we'll support. If we can't, then we will have to be honest. But the other side of land from this mutual relationship is that we always think, probably, and I hope, I don't know what we could discuss this at the end of the talk. We quite often think here in the UK, well, what's in it for me really to collaborate with a third world country? I am in Oxford. I am in Cambridge, in Dundee. What is it what's in it for me? And actually, when I look at this, there's a lot in it for us here in the UK when we go there. And I'm sure many of you who've been overseas to Africa and to other places, they would agree on the opportunities that can be developed and can be built through like exchange programs, whether that's staff exchange or student exchange. I have certainly seen this with elective courses when I invited the students to come here and then organize for others to go to Palestine. And our students here, our British students, they came back with rather lovely, extra, ordinarily positive experiences, whether that's related to pathologies they have seen, diseases they have learned about, how the services are run, let alone the cultural exchanges that inevitably takes place. Among the other set of lessons we've learned through this experience, that for success, really, you need to have advocates all the time, and you need to have strong advocates for these projects. And these advocates, they would have to stick to the rules, which I kind of hinted to in the previous slide, where like the local training needs must supersede what we think they need, and rather us patronizing and telling what they need, and it's just listening to that. And therefore every single mission and every project will have to be tailored to those local needs. This is if we wanted to like leave people with like a high impact. The other lesson we've learned is related to encouraging research, and certainly the culture there is encouraging. A lot of people are keen to get involved, but they don't know how to do it. This is something we here in the UK, we can, I think, get involved with. And again, this could be seen a mutual interest. How many of us, and I'm going to be honest and open here, how many of us are looking for a promotion, but they want to get an international involvement? So as I discussed this with the deans of medical schools here in the UK, we've been very open about it. Yes, we want to help there and we are trying to make difference, but there are some gains we can get here. And the approach here will have to be a multidisciplinary approach. Really, as far as Palestinians are interested, I think what they need like a holistic approach, like we started in IMED. So there's no point providing them with the best neurosurgeon while they don't have trained nurses who can manage neurosurgical patients. So this is why, I mean, in any project we've learned, if we were to make difference, we have to have that holistic approach. We certainly applied that in trauma. So in all trauma training, we looked at all those healthcare professionals involved. Same thing in child mental health. We trained social workers, psychologists, alongside psychiatrists and child mental health specialists. And we've been trying to kind of do it in that format. And if I was to give an advice, I think this is the way to do it in any theme to be picked up. Now, like, for example, we are moving to work on palliative care. Again, it is going to be like a holistic approach to involve nurses, social worker, alongside oncologists, but also anesthetist who and pain management outlines. And this is kind of how we are going about it. And if you see, like, I mean, in all these challenges that we've had there as we were going, we have always seen opportunities and potential for both sides here in the UK, but also in Palestine. And if I was to come up with a number of the solutions, a number of solutions to the problems we have there, and obviously, I mean, this is my own proposal, but I am open, obviously, for suggestions. And but I think really we could help there in undergraduate and postgraduate education, both in curriculum and protocols development. So we have, I mean, in this country, kind of walked miles on this field, and this is something, transferable knowledge, which can be exchanged easily there. We could help them to boost local training programs, again, in areas of needs. This can be done through different ways, whether that's through twinning between UK medical schools or between colleges. So I have started myself with colleagues in the Royal College of Surgeons as part of the Global Surgery Policy Unit. I don't know if any of you have heard of this development. This is an initiative by the Royal College of Surgeons of England. And now we are developing a scheme where we're getting support for surgery training, both undergraduate and postgraduate in Palestine. And this can be done with again, with hospitals, where like we could have like hospital exchange programs. And again, this could be of a mutual benefit for both sides. And the way I'm thinking about this is really a revolving door strategy. where UK and Palestine on each side of the door. And on one side, we have the Arab American University with its teaching hospital. And I am speaking here on behalf of the Arab American University as the dean, and I'm proposing the Arab American University as probably a prototype, because first of all, I am kind of leading this and I kind of interested in developing this strategy, but also the university, the president and the board of directors are very keen on this strategy and very supportive of it. But should we like prove successful, I'm sure this can be rolled over to other universities and other medical schools in Palestine. On the other side of the revolving door will be UK institutions. Certainly Dundee University has been leading on this, and we have signed an MOU with a lot of help from David Russell, who's on the call here, and Wendy Alexander, and again from the senior management level in Dundee University, a lot of support, a lot of interest. And some of the items really of this memorandum of understanding already underway to translate into impact on the grounds. As probably many of you know, we are organizing a summer school this summer, this July, for 20 students to come from Jenin to Dundee to enhance their clinical skills, their communication skills, and get exposed into a different culture, a different system. And this is only the start. David and I are also working on curriculum development and many other aspects. Obviously, on this note, I would welcome any involvement from colleagues on the call to help us with the summer school, but also if anybody is interested to come and join us there. We are open for discussion whether you want to come volunteering or you want to give up time and get money for expenses, your time. Any help is welcome, really, and we'd welcome. And I can't tell you how the need, and it is a despair situation. We are desperate on many aspects, and if anybody would like to step in and help us, we would welcome that help. Obviously, I'm not. This is for Dundee, but also we've had many happy relations which we are enjoying with Cardiff University, where I have established strong relations with the dean here in Cardiff, but also in Oxford, where I will be having a number of meetings as soon as I finish this Zoom. I'll be jumping in the car, driving into Oxford, where again we are organizing another summer school for another 20 students to come to Oxford. And actually what we are doing in Oxford, we are copying what David and I and other colleagues have kind of engineered in Dundee. So you could see how kind of that seed is already growing into a bigger plant, if not a tree. And with that strategy in mind, I think IMED 2000 as a charity, as a British charity, would sit in the middle and would facilitate this interaction, certainly would support and fund those initiatives should we need some funding, because we and my board of trustees and IMED 2000 are pretty much behind this idea of promoting this collaboration between UK and Palestinian institutions. And this is something we live for. So with that in mind for the charity, I promised them I'll put this slide up. On the 18th of May, we are organizing our main fundraiser, which since COVID, we used to have it in the Houses of Parliament, in the Houses of Lords usually every year. But since COVID started and this year is included, we moved to Zoom. So it's a lovely event where it's a small community where we get them together. We show the projects in the last year, what we have done in Palestine for the last 10 years. We also talk about other conflict zone areas, including Yemen, Syria, but also some work in Ukraine that we have recently started doing. In this event, we have usually a good lineup of like music, musicians, but also all other fun intervals if interest to you. So if you wanted to join us, please email on info@imit2000.org. We don't charge a ticket for the event, but we would welcome any donation, small or large, through this link if anybody is interested. And with that, I think I would close my talk. I would thank you again for the opportunity to address you and for your giving up the time to listen to me. Thank you so much, and I'm happy to take any questions that you may have.
Thanks so much, Malik. That's really absolutely fascinating stuff. I spent a week in Jordan last week. I was privileged to be invited to speak at the Jordanian Medical Society with a number of colleagues from around the UK, and was really struck at the enthusiasm of people all around the Arabic-speaking nations around Jordan, so Palestine, and across into Northern Africa. The people who came, it was such a well-attended meeting and such a desire to learn, and the humility with which they spoke to us about doing medicine that I couldn't even imagine. So the volume of medicine, the limited resources, yet the boundless enthusiasm and commitment to the medicine was incredibly humbling. And making those contacts and links has been really valuable to me, and particularly, I mean, the reason I was there was to share knowledge about COVID, and the way in which the COVID pandemic was managed in Jordan, certainly, which isn't a war zone. It's not a conflict zone. It is very stable in that area of the world. I appreciate that. And so not quite what you're describing, but even then it's so different from how we managed it. And I learned so much from speaking to people over there. I think you're doing incredible work, and you should be commended on what you're doing here. They're here everywhere. Does anybody have any comments or questions they'd like to make? Anybody? There's a wide range of folk in the audience here today. Clinicians, medical educationalists, scientists, and more. It doesn't look like anyone's being brave just now. So you said at the end there, you gave us an email address to get in touch with if there's things that we can do to help or get involved. Is there anything in particular that you're very short of? Is there something that, what's your wish list of what you need or would like to have from any of us?
Yeah. Thanks, Tom, again for this question. Yeah, look, the wish list goes around. If I talk about undergraduate medical education and being the dean in AUP, so the needs are around really expertise in curriculum development. This is a new medical school, and I think we would welcome UK expertise on that. So that's something we would welcome very much. And that's one thing. The other thing is on skills building. So I'm taking the same approach I took in IMIT 2000, where I'd like to, rather than stay dependent forever on external support, to train a group of trainers in the School of Medicine, where they become themselves trainers for others, whether that's in medical education, in leadership, but also in certain areas of basic medical sciences. So we are, again, short on basic medical sciences. The one which stands out the most is pharmacology. So I don't know, if anybody was interested here and they could put us in touch with colleagues who could help us in pharmacology teaching, that would be again of a great stuff. So that's for the undergraduate. On the postgraduate side of the coin, really, it is more opening sites and places here in the UK for short-term courses and fellowships, where we can invite people to come here, get trained in a certain aspect and come back. Certainly, I'm developing this with David Russell in Dundee and in the simulation center, but that's something, again, we would be open for more help on that, because one of the things which, kills you in Palestine, you go there and you find that, for example, a government from a developed world is donated, I would say something, let's talk about neurosurgery, ICB bolt, these high-tech stuff we use to monitor intracranial pressure for those who are unconscious on a ventilator. I went to visit one of the hospitals and they had a rack of them sitting in the corner. So, they said, we could donate this. So what is it for? Okay, nobody knew what it was for. And this is the problem. I think we need, quite often the resources are not too bad there because we get support from here and there. But what we need to develop is the human resources. And this is where I am really leaning to and turning into British colleagues and friends to support us in just really developing human resources and human capacity.
I think that chimes very much with what colleagues in the global citizenship arena say, is that there's a lot of stuff gets sent, but as you say, it gathers dust in a corner because it has the wrong plug, or it has the wrong adapter, or it's just new technology that just hasn't seeped through to that region yet. I remember back in 1997, I spent some time in Uganda, and exactly the same thing. A Scandinavian charity had donated a huge number of electric beds and kit and caboodle, and they had the wrong plug and worked off the wrong voltage, and they were completely hopeless. And that's now many years ago, 25 years ago, and it stuck with me. And it's a shame that that's still happening. We do take in respiratory medicine, we have fellows coming from Europe. I've got a Portuguese doctor sat in my clinic this afternoon in 20 minutes time, and I don't see why we couldn't extend that out to colleagues from Palestine and the region. I think that's something we should really talk about. David Russell, who linked Malik into the Grand Round program, said we're trying to secure funding from the Arab Fund to train surgeons in our surgical skills centre, and again, I think that's really valuable stuff. You mentioned simulation already as being somewhere to come and actually get the practice in a safe environment. I think the fellowship programs are very dependent on funding, and it's then just getting through the red tape. But I think that's something we could probably talk about. If respiratory medicine is one of the areas that you're working on, I suspect that's something we could help with in our own department.
Thank you. I much appreciate that.
Okay, any other comments from the virtual floor? If not, I will just share with you the QR code, so you can scan the QR code that takes you to the digital form that allows you to fill in your details, including the talk today, and then you'll be emailed your certificate to say that you are at Grand Round, so you can put it into your CPD diary and count it. It also means that we can add to our database that you were here, and we know what is popular, what is not so popular, and how we can then tailor our program going forward. Next week at Grand Rounds, psychiatry, dementia on orthopedic wards. So, Suzanne Gray is going to come and talk about some findings of research about the incidence of dementia in orthopedic wards and how to manage it. I suspect it will be very relatable to not just orthopedics, but all the general medical and surgical wards across the hospital. So tune in for that. So all it remains me to say is thank you again to Malik for his really interesting talk. I think you'll see that there is some chat coming through from the audience, and Malik, you've given your email address, so thank you very much for that. And I think, as David has said, you are visiting next Tuesday. I'm on call. I will do my best to try and find you and meet in person. Everyone else, thank you so much. Thanks again. Thanks for joining, and we'll see you all next week.
See you. Bye.